Hello everyone. For this assessment, we are going to be looking at the range of motion of the rectus femoris, which is another one of the hip flexors along with the iliacus and the psoas major. However, the rectus femoris crosses both the hip and the knee, so it aids in hip flexion as well as knee extension. Common sporting action is, of course, sprinting. As we know, limits in range of motion of the hip flexors are going to reciprocally inhibit the glutes in their ability to produce force, which then shifts that force production onto the hamstrings, increasing the risk of injury. In terms of setup, it's the same as the modified Thomas test for the iliacus and psoas major. However, for this assessment, we are going to place the knee and hold the knee at 90 degrees of flexion. This way, we fully lengthen the rectus femoris and can limit the inclusion of the iliacus and the psoas major in this assessment. So we're going to have the athlete or patient sit on the very edge of a table or bench with their glutes hanging off. This way, if the athlete or patient has larger glute musculature, it does not prevent them from fully moving into hip extension. From there, the athlete is going to hug both of their knees as close as they can to the chest without moving into posterior pelvic tilt, so the upper portion of the glute is still going to be in contact. From there, I'm going to take the measurement and make sure that the testing leg is at 90 degrees of flexion at the knee. I'm going to help the athlete move fully into their passive range of motion of hip extension. And then at that point, I'm going to take the inclinometer in line with the femur, take the measurement, and mark it down. Now, at the same time, I'm also going to ensure that there is no external rotation of the femur. This would just invalidate the test. However, if there is external rotation or if the athlete tends to move into external rotation, we know that there's potential tightness of the TFL or the glute medius. Now you can see here I'm doing my best to keep the knee flexion angle at 90 degrees. However, with only one practitioner or one person performing the measurements, it is a little bit tougher. So if there's the ability to have more than one person taking the assessment, this would be a great place for them to step in to ensure that angle stays at around 90 degrees. Now, as you can see, we're going to take two measurements on each side. From here, we're going to take the average of that measurement and then look at the existing literature and normative data and compare the two.